Dr. Nigel, welcome to the Thriving with Diabetes podcast.
Thank you, Gamden. I appreciate the invitation. I look forward to a inspiring conversation today.
Brilliant. It is great to have you on our show. The first thing that I want to discuss with you or ask you questions about you is about the urinary incontinence. You know that many women experience urinary incontinence, but it is often not talked about enough. And the question is, why do you think urinary incontinence is such a common but overlooked issue, specifically for women?
You know what? That's a perfect question to start the dialogue going. Is the reason it's really not been managed is the stigma that goes along with it. So I always encourage people to look back to one of the very first milestones that you had as a child. And we look back and said, well, what was the first thing that you did when you were 2 to 5 years old, let's say? And that was you gained bladder control. You remember the children are like, oh, we're so proud of Susie. She learned how to use the potty. She doesn't need diapers or pull-ups or nappies or whatever. It goes back to our formative years. So we've so much accomplishment attached to that. And, you know, is it psychological training from our youth? More than likely. The basic understanding is everyone should be able to have control of that part of their body. And when they don't, there's a whole cascade of other emotions that stir up. And let's be honest, is challenging things we would much rather avoid than address. That's kind of a human condition in my observation. So I think incontinence is just a really big, screaming example of that. Therefore, very few people talk about it because even though the professional or even the family member that they might talk to that about that condition with, they don't have judgment perhaps, but the person talking about it has a lot of self-judgment around that topic. And therefore, it's left to fester and become bigger and bigger. And if you watch television much, which I usually don't recommend for your health, but if you did occasionally, is you would notice that the adult diaper industry has exploded. So we have two industries exploding, pharmacology and diapers. So clearly there's some problem somewhere.
Oh, that is frustrating. So it's a serious issue, even if people don't talk about it. Is that correct?
Absolutely. So let's just go back to even childhood, as if any of your listeners are parents, is what happened when your child stopped needing diapers. That really opened up a whole lot of new experiences for the parents in particular, right? They wouldn't have to prepare for those things. They wouldn't have to prepare for cleanup. The car drives were easier. Obviously, once they started going to the bathroom, you had to, expedite them if they had to go to the restroom. But it becomes a milestone of life. And then when it's changed and removed, a lot of those milestones are taken away. So just think about the independence of travel, going to the grocery store, going to a sporting event, going for a walk or a run. All those things are going to be altered because of that inability. And that's a big deal when you think about all the little events in our lives.
Brilliant. Thank you for sharing that information. Very interesting. So we know there is an issue, but how do we know, or how do we know early? That's where we are going to talk about the signs and symptoms. Sometimes we might think it's not that, catching the early signs of bladder issues can make a big difference in how we or they who are suffering from can manage them. So the question is here, what are the early signs of bladder problems women maybe men should pay attention to?
Sure. So I like people to reflect back to the times where they didn't have to think about it at all, excuse me, is you didn't worry about laughing or jumping or playing, or you didn't worry about any of that stuff. That is normal bladder control. Any variation from that, I don't like to call things diseases because they're end stages, but anything other than that is abnormal. So the question isn't to become overly worried about it or to get very dramatic, but it's time to start thinking about it like, oh, I noticed that when I bend over, I can't hold my urine as easily. That should pose a question in a person's mind. Instead of just disregarding it and saying, oh, it's nothing, is just ask the question is why. And we're going to talk probably today about some simple things people can do at home, but even like with diabetes is an end condition from a long cascade of buildup. So, and I'm sure you talk about this, is you make small changes early in course, it never gets to the end course. The bladder's no different, is if you're watching these little signs, and it's very easy to tell, especially with the bladder. It's like, oh, I'm leaking. Oh, once I have to go to the bathroom, I get halfway there, I undo my pants or trousers, and I start leaking. Those are all signs that we're losing some of the control patterns, and they're easily addressed at the early stage. They're always addressable, but they're not, just like with diabetes, is you can't always get where you want to go the further down the course of problem you've allowed to happen.
Very interesting. So one of the main thing or signs you mentioned that is when we feel we are not confident to do a physical activity like jumping, that could be a sign of an issue or a signal that telling us there is something wrong. Or what we can experience, we hold urine, but we cannot hold it longer.
Sure.
So
you've really,
yeah.
I'm sorry, go ahead, Gavin.
No, that's fine.
So you've kind of hit on the two basic criteria of incontinence. There's called stress, and then there's called urge. And like with any classification, nothing is ever perfectly one thing or the other, but the one has more to do with anatomy and physiology of that region of the body, and the other has to do with the autonomic nervous system. And of course, we're whole beings, so they're all both working at the same time. So from the point of jumping, that often relates to is there's been something changing the tissue integrity of that region. So for an example, it's very common for a postpartum mother to have incontinence. That's expected. Given what's been going on in that region, the trauma, the body needs time to heal. There's nothing of concern with that because it's cause and effect. Now, if it delays longer than 6 to 12 weeks, then we start looking and say, hey, has there been injury? Has there been scar tissue? Has there been some neurologic changes? Has there been hormonal issues that haven't balanced out? So, those are the criteria that we look at stress. But the biggest, most common cause is a mixture of stress and urge, where it's an autonomic nervous system dysregulation. So if we break down what that means, is we have the autonomic nervous system, which is constantly controlling our body all the time without us knowing about it. It's beating our heart, it's gobbling up viruses and bacteria, it's keeping us alive. Well, we have what's called an autonomic tone. So if we think about the bladder, the nervous system, and I like to think of it like a bicep muscle, like an arm muscle, is somebody who exercises, their arm muscle is going to feel strong and tight even when they're not exercising, because the tone of that muscle is heightened because of the practicing and the training. Somebody who doesn't exercise or use the nerve or the muscle much, their tone is much more flaccid. Well, the same goes with all other systems like the bladder, is if the tone of the nervous system isn't as robust, or it's been changed from hormones or blood sugar or diet or inflammation, then that bladder's integrity becomes less efficient, just like that person who has a non-conditioned or deconditioned muscle in their arm. So now when you challenge it, let's say you pick up a jug of something, the strength is less. Well, if you have to hold urine, well, your integrity is less. Therefore, it has more likelihood of leaving. So restoring or improving the autonomic tone, which is a nervous system training, is essential for long-term bladder function.
Brilliant. Thank you for sharing that helpful information. I know you talk about bladder retraining, which is a technique people may have heard of. However, they don't know much. They don't know much about it. So my question is, can you give us some information on how bladder retraining works and why it is so effective?
Sure. So let's just change to topics that are easier for people to grasp. Is if I can't lift a mug of tea or coffee because I don't have strength, I need to build that integrity. So what am I going to do? I'm going to use something to challenge that muscle. And I'm going to start slow and I'm going to build up. The bladder and the pelvic region are no different. We're used to not even being aware of what happens beneath our waist, right? But the tissues there have an imperative role. So I encourage people simply at home, just when they go to the bathroom and stop, and then start again. Stop, start. That's simply a Kegel exercise. They're not terribly effective, but they have some value for sure. But they help people become aware of those are muscles and those are tissues and nerves that are busily working, and it helps people start to regain a little bit of control and awareness of the pelvis, the bladder, and the perineal muscles, which are the ones down beneath your groin.
Brilliant. Very interesting. And this will lead us to the second part of this episode, which is about solutions or approaches that we can focus on. So I wanted to ask you about nutrition and exercise related to bladder health. So are there specific foods or exercises you recommend for improving bladder health naturally?
Sure, absolutely. So there's a saying I like to bring up regularly, which makes a lot of sense. It says, "What's good for the goose is good for the gander." So, which simply means, of course, what's good for you wholly is good for your bladder. So let's take a closer look. If you're managing blood sugar, for example, and you're looking at simple carbohydrates and sugar, all those create an insulin response. All of those create inflammation. So that might not only just be inflammation of your blood vessels, which of course is going to affect everything from your cholesterol level to your lipoproteins, etc., but it's also affecting the linings of your blood vessels and the linings of your bladder. So the big key is an anti-inflammatory based diet, and we've had the best success over the years using, I don't like to get behind one specific diet, but protein and vegetables are the two key components that I like to have people understand. Now, there's exceptions to this rule. So if I was helping a patient in my office, let's say, manage a chronic digestive condition, they might have food sensitivities. So this isn't addressing other specific issues, but for general, we would say protein and vegetables, because it's going to allow you building blocks. It's often going to contain healthy fats, which are going to help support the nervous system, and it's going to support the blood sugar, and it's going to reduce the amount of inflammatory foods that are entering your system. Less inflammation, less irritation to the bladder. Now, there's specific type foods that are known irritants. Carbonated beverages are a big one. In America here, it's a big deal for everyone to drink. I call them bubble waters. So they're carbonated water with nothing else in it, maybe some flavorings of some sort. So the carbon dioxide in there is also an irritant. It changes the pH, it affects blood vessel linings, it affects stomach linings, and so the next thing would be caffeine. Caffeine being a stimulant, but it's not even so much the caffeine from coffee or tea. What I've found is the tannins from tea. So most people might be familiar with tannins. They're found in wine, and they're what make your tongue feel rough when you put wine in your mouth or tea. Is tannins break down mucus. Mucus protects linings of the stomach, of the GI, of the bladder, etc. So when you start breaking down those linings, or the mucus lining, excuse me, you make the tissue more vulnerable and sensitive. So I encourage people to back off things with tannins, the tea, the wine, the coffee. And I found personally and otherwise that it's not even the caffeine, even though caffeine can cause some issue, is non-organic tea and coffee are a bigger problem, because when you add in herbicides and pesticides that are existing, they have a whole myriad of different factors, from endocrine disruptors, which is a bigger problem, which means it's chemicals that work like hormones, to you don't really know how far reaching it goes. But organic is key, reducing the carbonation, reducing the coffee, tea, and wine. And that's usually a good start for the early incontinence sufferers. They'll notice notable changes. I'll just speak personally, as I enjoy coffee, and my wife teases me. She said, I bought you some Pee Your Pants coffee. I said, well, what is that? She goes, I didn't find any organic. I said, well, take it back, because anytime I don't drink organic coffee, I get bladder spasms, and that's my cue that I need to step back from that type of coffee. So,
what about exercise?
Sure. So exercises, I would start with just that simple Kegel variation, and we can talk more about this later. It's not terribly effective, but it's super helpful for people to start to become aware of their perineum and aware of bladder control. So if a person going to the bathroom stops and starts 5 or 6 times every time they go to the restroom, that in itself is going to start to gain some mental response, but also physical improvement within that muscle. My ironclad bladder protocol takes that to a whole other level, but I like to give people the Kegel because first, everybody's heard of it somewhere, but it really starts to improve awareness, and it starts just touching on the strengthening component of the pelvis. It doesn't do much for scar tissue or some of the more deep irritations of that area, but it's a very good first step.
Actually, I want. Have you finished?
Yes, please go ahead.
Actually, I wanted to ask you about walking.
Sure. So walking's key. And that's a perfect starter. What I encourage people to do is, if they're having incontinence issues, walking is always essential for anybody. I would say 10 to 15 minutes every day. If you do have incontinence issues, people can also begin to just become aware when they're walking, and they can do that Kegel type exercise while they're walking also. Is just envision that you're going to the bathroom and how that would feel, and then you can hold for several steps and then relax. Hold and relax. Again, that'll help you. The impact of the feet will help challenge the bladder. The increasing in the perineal tone, that's the squeezing, that in time will also help support that process.
Brilliant. Very interesting information. Thank you for sharing that. So you highly recommend people to go organic. One of the foundation when it comes to nutrition is proteins and vegetables. You mentioned healthy fats. We shouldn't be afraid of that, and try to avoid chemicals as much as we can.
Agreed. 100% true. All of the above.
Brilliant. Very interesting. Thank you for sharing that helpful information. The next point that we want to discuss is about natural health care. I know your approach to bladder health uses natural methods instead of medications, which is interesting. The question is here, how do you combine traditional Chinese medicine and neurological science in your natural approach to treating bladder issues?
Yeah, that's an awesome question. Is what I like to do to answer that question is I like to look at anatomy because it gives us the answers when we look into it more deeply. So once we understand the bladder as a balloon, and then you understand like a balloon where you'd blow it up, you imagine a straw coming out of there, and the straw of a woman is like an inch. We're talking a small straw. Obviously a man would be longer, but that little inch would be what's called the sphincter, and a sphincter is nothing more than a valve. So when you study that neurologically, that valve is only around 30% what's called consciously controlled. That means that you can only, and this is why that's why I don't endorse Kegels as a primary approach to incontinence, even though it has value, because it's only addressing 30% of that sphincter or that valve. So the question becomes is, well, what's the other 70? And the other 70% of the valve, and then we'll talk about the balloon and the bladder in a second, is autonomically controlled, which means its tone is directly in the back of your brain, autonomically, unconsciously being controlled by the tone. So at best, you're working with 30% when you're consciously doing an exercise for the perineum. The other 70% lies in the brain. So if you look at ongoing management medically, one of the common treatments for incontinence is a beta blocker. And so if anyone's familiar with what a beta blocker is it blocks a receptor site that attaches for adrenaline and cortisol and some of the stress hormones. So the question would be, why would they be giving a stress hormone blocker for management of bladder problems? When obviously the answers in the question is because somebody down the line has realized or stumbled upon it that when we address the nervous system, we can help some of the bladder function. Well, obviously natural health doesn't really involve suppressing certain things. You want to enhance the body system, but that's where traditional Chinese medicine comes into play, is when you can address the autonomic nervous system, most notably the vagus nerve. The vagus nerve is what's going to allow us to change the tone of that valve, and also the unconsciously controlled muscles called the detrusor muscles within the bladder. So traditional Chinese medicine is like a great resetter. So in my ironclad bladder system, what we do is we do 3 to 4 different techniques that a patient would do or a person would do at home. Instead of having to see a doctor or an acupuncturist to have it done, you can actually help stimulate those points at home to help support that bladder. And it's in conjunction with retraining the muscles and retraining some of the mental habits. So until you address that 70% of the autonomic nervous system, you're not going to see the results that you're looking for because you're only touching on about a third of the actual problem. Does that make sense?
Yeah, very interesting. So, like in basic explanation, that what you're saying is we have got only 30% that we can control, and the rest was or is controlled by our brain. Is that correct?
Correct. Unconsciously by our brain.
Okay, brilliant. Very interesting. And that's why you don't recommend people go straight away to medication. So they need to try something naturally first, unless if it is like a severe condition.
And Gavin, I'll just take that a little further, is there's not great management medically anyway. Even so, I'll tell patients, they'll say, well, is there just a drug for this? And the answer is no, there's not a drug for this. There's drugs that help you a little bit, but none of them get to the root cause. So it goes back to symptoms. And let's just talk in a more customary way, is it's like somebody taking insulin. It's like, okay, well, I'm augmenting my blood sugar management for the short term, but I created this over a lifetime. Now, this is type 2 diabetes we're talking about, obviously, but your habits have to change for long-term solution. So drugs aren't a solution, they're a helper along the pathway. So when it comes to bladder and urinary incontinence, it's even less so, because the medication doesn't even offer much solution at all. So it's not a one or the other, it's you got to start with the natural, because the other isn't a long-term management technique. It's just to get you through the tough spot. Brilliant. Sometimes. Sorry.
Very interesting. Thank you for sharing that. Is there anything we didn't cover today?
I would say the biggest thing, Gavin, is don't let things go, and this goes with all sorts of different issues, and it's a silly analogy, but I like to think of it like a freight train. Is the closer the freight train is to hitting the wall, the less options you have in front of you. The best opportunity you have is 1,000 miles before the wall. You make tiny little changes, early on, and it doesn't disrupt your life whatsoever. If you're making crisis changes right about when you're ready to hit the wall, you usually can't change enough to get yourself to where you want to be, because it's just too far. Now, the body's capacity to change is amazing and great, so there's always exceptions, but it's always easier to make small changes than it is to make life-altering changes because you're in crisis. And so that's my program is so important, is talk about it too, is usually our worst judgments are our self-judgments. So patients that I'll talk to, I'll say, they'll be embarrassed, and I'll say there's no need to be embarrassed. I see hundreds and hundreds of people, and they all feel the same way, and it's okay. So I guess take a leap of faith a little bit of realizing it's not as embarrassing as you think it would be, and there is viable help that's actually quite easy to implement and to resolve.
Brilliant. Thank you for sharing that. I have got another question before we finish this episode.
Sure.
What inspiring message would you like to leave with our viewers and listeners to motivate and help them on their health journey?
Sure. So simply enough, and it goes back to my previous discussion just a moment ago, is we as human beings make really big deals out of the problems that we have in our own mind, because they're always there, they don't leave us, right? So we think about them at night and we allow them to build, and then they overcome us. What I'll encourage people to do is think less, judge yourself a little less, and then don't wait, because what often happens is we rationalize things. Oh, it's not that bad. Oh, I just change my underwear a few times a day, or oh, it's only $20 a month for my my undergarments, or whatever it might be. We justify, and that's kind of a human nature thing. Is I encourage you, don't do that, because everything in life has to go in one of two directions. It either has to get worse or it has to get better. It never stays the same. So if there's an incontinence issue now, it has to be worse. And of course, when it's worse, it's always more challenging. And there's one other saying that I like people to remember, is the best time, there's two times to change. Right now is always the best. Yesterday is always the best time to change, and the second best time is today. So, because each day that goes by, it's harder and harder to make those shifts. But there's help, and it's easy, and it's inexpensive. That's always the best time to make big leaps.
Brilliant. Thank you for sharing your great, inspiring message. So think less, don't judge yourself, and act quickly.
Awesome.
Where can people reach you or learn more about your work?
Sure. So simply they can just go to Dr. Nigel, Nigel, last name Brayer, .com. And there's tons of information about urinary incontinence. There's information about foods. There's bladder hacks that people can learn. There's a lot of good freebie stuff there. There's a way to get in touch with my work. I also have a book on what's called stress, called The Stress Effect, and how that affects our body and inflammation. So there's lots of great resources on that website, and you can touch base with me on Facebook. There's a lot of different means, and we'd be happy to help.
Brilliant. Thank you for sharing your contact information. People can find the link for your website in the show notes and the social media as well. So better to go to his website, and from there you can navigate where you want to go. That brings us to the end of this episode. Thank you, Dr. Nigel, for sharing helpful tips and insight. Thank you, everyone, for watching or listening to this episode. If you need additional guidance, you can book a call at wellnessimpact.org. If you found this episode valuable, I encourage you to join our thriving community for more insights and strategies. Until next time, take care of your health and keep thriving.